It's when you on your journey that it comes to you, and you have to probably do your own research, right, and figure out what is the best way.
Yeah, I have a podcast episode next week about doing your own research, which is a solo episode because somewhere
Right.
along the way that became taboo. So I got to ask you, which by the way, like doing your own research, that used to just be reading, learning, and I can see now on the internet there's pretty much a reputable source for anything that you want to believe. So,
Mhm.
doing your own research, you got to pay attention. But when you say do your own research as a doctor, I would imagine there's scenarios where people come in diagnosed already from WebMD and Google search and probably now Chat GPT as well. So when you say do your own research, what does that mean to you and how do you encourage people to do that?
Well, I mean, it depends what the problem is, right? So if it's something super serious like cancer, or the fact that you're fatigued, right? What does that mean? What blood work or workup is being done when you go to the doctor's office? If you just go to a straight insurance visit, you're going to be given a very basic assessment. And then the doctor might throw his hands up in the air and say, well, you're fine, but you don't feel fine. So that's
Mhm.
where the true art of medicine comes out, where you have to go take a deeper dive into these things. But just off the bat, me as a clinician, I can look at somebody and be like, this is what I think is happening. But then I have all these tools in my toolbox to take a deeper dive. But if we're only using 1/10 of all these things, then that's very limiting. Now, today we have the wonders of all our chat GBTs and language models, and those are kind of allowing people to do that perhaps. We're able to, if you ask the right question, then you can maybe get other options, right? I think that's what's good in today's world of just information being democratized more. So it's not just the gatekeeper, the doctor in the white coat that is saying my way or the highway. You are able to make decisions and go deeper if you so choose to. Now, if you're just stuck on the treadmill on that conveyor belt and saying, I'll just follow blindly whatever that doctor's telling me, then that's your prerogative. But I think you have to understand in life, you have to take just more angles to things, especially if your health is the most important thing, which I think it is. You need to really get more opinions, not just with me, but other people. And I'm not going to get offended because that's the way I see helping you. And I'd like to refer to people that can give these people the benefit, right?
Mm. Yeah, you're so right. And I kind of realized a while ago, and I give this advice to people in my life when they don't ask for it, but when you're feeling sick or you've got some sort of diagnosis or autoimmune disease or something like that, like I think you've got to do your own research, but like see multiple doctors, understand the potential causes, and just take control of it because a lot of times, in my view, a doctor, like you said, it can be very transactional when you're dealing with insurance. A lot of times, it doesn't cover blood work, or at least in my experience. So it's here's something to take care of that tiredness, or here's something to help you sleep if you're not able to sleep. And there's no blood work to find out what could be impacting that, or if there's something hereditary, or just something even like blood sugar, like people having blood sugar issues and stuff like that, you can maybe fix some of that a little bit differently. So I'm grateful for that, but it's really hard, I think, for people. And I think some of it's culturally, but I see people struggling with they want like that quick fix, which, you pop a
Mm.
pill, you take a drink, you do whatever that is. And it's hard to take accountability, but you got to kind of be your own advocate with your doctors.
100%. I agree. Yeah.
Yeah. Yeah.
Whatever got you there to that sick state, it won't take as long to fix you, but it'll be a process.
Yeah, exactly. Now we don't have to like dive into the depths of insurance, but you kind of alluded to this. Like you go to a doctor, and I don't get sick very often, but I got really sick this winter for like 3 months. It was like influenza A turned into a sinus infection, got a little bit better, got another sinus infection, turned into pneumonia. It was just like this horrible thing. And every time I went to the doctor, he was fine. He was better than most I have, but it was
Mhm.
very much like why do I keep getting sick when I usually don't get sick like that and
Yeah.
stuff like that. And so even seeing, like, I saw an ENT and ear, nose and throat specialist, and then she gave me a totally different perspective and like, well, instead of treating that, why don't we figure out like why you keep getting sinus infections? So let's try some
Mhm.
different things. And it was just like a very different approach that I appreciated. But I think
Yeah.
with insurance and stuff like that, you get kind of trapped into this. Well, they want to get paid by the insurance. And to do that, you got to like fit in this specific box. So do you deal with that in your experience and as well with patients?
Unfortunately, I do. It's one of those things where I do take some insurance still, so it's hard to unlock all the tools in that toolbox, but I
Of
do offer
course.
people things that hopefully can be included into that. So,
Mm,
with that being said, like you said, why are you getting, is there something irritating you? Is there something that perhaps does not serve you? And if so, and if you are still getting sick, there's things that we can do beyond just antibiotics. We can, you know, basically this is it's a very similar story. A patient who had exactly what you're talking about, getting perpetually sick. His kids were bringing illness after illness. He was missing work, and now patients come to you, a doctor, and say, "Look, I've heard of alpha thymosin. Can I try it?" And he's gone ENTs, he's gotten the CT scans, he's gotten the MRIs, and nothing worked, right? But then we tried the alpha
mm.
thymosin peptide, which which got his immune system working, hasn't been sick then since, right? And so then I even incorporated that for my staff doesn't have necessarily sick days anymore because as soon as somebody's getting sick, they get something like that. So things like that
What is
are really
that?
exciting. So it's a peptide, right? And a peptide is an amino acid which is joined together. So you have a few of these things that are joined together. Peptides, you've probably heard of them, right?
Mm, I've
More
taken
or
them.
less,
Yeah.
right? You have a
Not
bunch of
this
them.
one.
Well,
Yeah. Hmm.
right. So this one is very interesting. It's actually approved as an adjunct for melanoma treatment, but we can use it off label and we can help rev up the immune system a little bit so we can fight off some of these viral infections. So you don't have to even get on that antibiotic. You can hopefully bounce back. So that's something exciting. If you have something like that in your toolbox, which wasn't taught in residency or medical school, this is something which you kind of learn as you enter this field. It's really exciting.
Hmm. Why do you think so many of these things are just not available to the regular person and not mainstream when they're obviously like probably less invasive things that we can do to make ourselves heal?
I mean, I hate to use the it's big pharma's fault, but it's kind of
Mm,
follow the money and the insurance, right? Because what pays the most? Going to the
yeah.
hospital, ER visits, and then getting these big pharma medications, right? So if there's an impetus to push that out, then unfortunately that's where doctors will be trained on using them more versus these things.
Yeah.
Sad, unfortunately.
It is. It is sad. I'm just like, I'm so alarmed by how powerful it is because like I always remember like growing up, my dad would say, if there's a cure for cancer, we'll never know about it. And I never understood that until I got older. I'm like, what are you talking about, Dad? Of course they would cure cancer if they knew how to cure cancer. But like it's almost speaking of mafia, it's like a mafia or a cult
Yeah.
of some sort. And you're in it and then you're stuck in it. But what I think is what is interesting about your story too is you've you've made this sort of I don't know if it's a transition or kind of more like you've accumulated the longevity piece in your practice and in your philosophy and stuff. What triggered you to go down that path? And then what is longevity to you? And then what sent you down that pathway?
So longevity now is something that's still been around, but it's kind of morphed into different descriptions. So in the 90s, it was called anti-aging medicine or alternative medicine. And now it's kind of gotten the label of longevity medicine, which is basically the confluence, I think, of all these cool things coming together, our technology, the medicines available, and our thinking, where we're able, hopefully, to actually just stop aging in its tracks and ideally reverse it. So, all right. Um, this has been something that's been just an echo that's been growing louder and louder as one has been aging. Longevity is not for the
Mm-hmm.
20-year-olds, right? That's something that they think they're immortal. They're going to make their mistakes. I think it's good for letting them know. By the way, there will be something called your late 30s and 40s that will arrive, and things will be perhaps breaking down if you haven't been taking care of yourself, right? So, I have two children. I'm married. I want to be there for them. I notice certain things in my body that father, like for example, my father. I do not want to have
Mhm.
his diseases that he has presented with. And simple question a doctor asks, what's your family history, right? Well, if my father has had five stents placed in over 5 years
Oh my
and has
gosh.
had, heart attacks, and his father died of a heart attack, cardiovascular disease, and so forth. Everybody in my family has these problems. I don't want to have these problems, right? And there are ways to do that if you do the right things.
Thank you for listening to this clip from the full episode of Eyes Wide Open. Please like and subscribe for daily clips and new episodes that drop every Tuesday. I appreciate you.